females tolerate pain better than men.
Is it true?
That's a fact. But that's not good. They miss heart attacks.
Meet Dr. Naveed Ahmed, head of cardiology at Aster Hospitals and Clinics, the heart specialist behind saving 15,000 hearts in the UAE. From saving lives in emergencies to treating rare conditions, his work has given countless people a second chance to life.
I'm thin, so I won't have a heart attack.
That's a myth.
I work out daily, so that means my heart is healthy.
That's a myth.
I only ever use olive oil in my cooking, so I don't need to worry about a heart attack.
That's also a myth.
If you're having a heart attack, you'll only have pain on the left-hand side of your body.
That's a myth.
No.
20 to 40, the risk of heart attack has grown up. Even we have seen less than 20.
What's causing heart attacks in young people?
It's a myth to think young will not suffer heart events and only exercise will prevent them. Exercise will help in reducing the risk, but exercise itself is not everything.
I hope you don't mind me asking you this. How does it feel when you lose a patient?
I feel terrible. I wish I had seen him a bit earlier. I would have done something which would have probably helped him to save his life. When I see family crying, even I become emotional. It feels like I lost my own.
Today's guest is directly responsible for over 15,000 healthy heartbeats. He's done literally thousands of emergency life-saving procedures to save people in time. Dr. Naveed Ahmed is here to show what's really going on and what you can do in 90 days to protect your heart. What actually is a heart attack?
Heart attack is basically, it can be defined as sudden stoppage of blood supply to the muscle of the heart.
What actually causes a heart attack?
When we are born, the arteries are clean. They supply good amount of blood to the muscle of the heart. When we grow with age, cholesterol gets deposited in the arteries. So this causes narrowing in the arteries. So some part of time when this cholesterol blockage, they rupture, it results in clot formation. And then the blood which is flowing stops, and that leads to damage to the heart. Nowadays, we see as early as in 20s, 20 to 40, the risk of heart attack has grown up. Even we have seen less than 20.
Why is that? What's causing heart attacks in young people?
It's a mixture of environmental causes. It's personal habits. Most of them are, leading a sedentary life. They're just less job. They don't work out. So that is leading to obesity. Most of them are heavy smokers. When they visit to me, when I ask them, they say, no, this relieves their stress. So they keep on smoking. They're spending sleepless night. That is putting them in immense stress. So all this put together, that increase the risk of heart attack in very young individual as early as like in 20s as well.
3 things that people can do to stop their heart becoming unhealthy.
Important thing they have to understand is whatever job they do, they have to be active.
The 10,000 steps idea.
That is a minimum thing what they should plan out.
Yes.
So this is the minimum activity what I'll do every day. The other thing is like the food. Rather than cooking, rather than getting some salad and all, let me go and grab something. That is not good. That is one thing one has to avoid. A third and important thing is screen time in adulthood that leads to obesity and physical inactivity. And all those things are the risk factor for the future heart attack. When mind doesn't relax, they are in immense stress. So that stress itself will lead to, increase in blood pressure and heart attack. That predispose for heart attacks.
Sometimes people might have a health scare, and at that moment they suddenly become really well behaved for about a month or two.
Right.
But then, it sort of trickles away, your good intentions trickle away, and all of a sudden you're eating, naughty fried food again. How can you make those fear moments turn into long-term good behavior?
As doctor, as cardiologist, we have to take this opportunity to educate in a better way. When they come to us, they come with some questions, in the mind. What are the risk factors, what they are having? Are they running the similar risk factor? Do they have the risk of heart attack? We need to sit with them. We need to understand their history, take the detailed history. There are battery of investigation, what we can propose to them to identify the risk factors. Like, for example, a person, they might not have checked their blood pressure for long, even diabetes or high cholesterol. So this can be detected for the first time when they visit to us. So that is the right time. Identify it, manage it, guide them how often they have to visit us, how to manage it with the medication, with the diet, with exercise. I think this is the best way. This is the vulnerable time where that with the fear they come to us. Rather than scaring them, I think we should take an opportunity to educate them, help them to modify the lifestyle and reduce their risk factor and improve the heart health for them.
Can you think of any case studies, any people that have come through your surgery door, your consultation door, and who are a sort of surprising, unexpected case?
I remember one young guy. He was in 20s. He's a gym trainer. Obviously, no one thinks gym trainer can have heart attack because they are continuously working out. They have a good body. This guy came. He had chest discomfort. He had very typical history, which was suggestive of blockage in the heart. When I started talking to him, when I started addressing him, he was not ready to believe it because he thought, I'm young, I work out, I'm muscular. How can I have all these things?
Yeah,
Then
I would be the same, frankly. Yeah.
Then we did stress test, which was strongly positive. Stress test is like treadmill test. That helps us to understand whether the person has angina, that is like heart pain. Indeed, he had a strong positive treadmill test. After that, we did an angiogram on him. He had critical blockage, more than 90% blockage.
But how? So how can you look fit and muscly and yet have blocked arteries?
When I asked his history, what I could understand, while he was back in India, he used to abuse anabolic steroids, which again puts risk. He used to have a lot of other, supplements which were not registered, whatever they used to get. And he had a very strong family history. His father, his father's brother, all of them suffered heart attack in their 40s. So he was running a risk with the strong family history and the lifestyle. It's a myth to think young will not suffer heart events and only exercise will prevent them. No, exercise is a part which will help in reducing the risk. But exercise itself is not everything.
Quite a lot of people watching this now will suddenly feel a bit nervous because you've totally challenged my preconceptions, and I'm sure you've challenged lots of other people's preconceptions about heart disease and when you might suffer a heart attack. So what are the warning signs? What should we be looking for?
The most common and typical symptom, what we call is angina. What is angina? Whenever somebody exerts, when he walks fast, when he walks on the slope, when he climbs stairs, the most common symptom, what they say is they have a central chest pain all over the chest. And that radiates either to the left arm, right arm, neck or back.
So it's different from indigestion?
Yeah, this is different. This is typical angina. Typical chest pain related to heart is they will have chest pain while walking or climbing stairs, which will radiate to the arms or the neck. Some individual, especially in diabetes, what happens? The pain fibers, they get damaged. They don't appreciate pain. That's how they miss the symptoms. Some individual will also complain of tiredness. They'll feel like I'm getting extremely tired, which I was quite okay earlier. In females, what we have observed is they present little different compared to men.
Oh, really?
One thing is because we have seen females tolerate pain better than men. Indeed, that is the fact.
Is it true?
That's a fact.
Oh, I love that fact. I'm going to take that one away with me.
But that's not good in another way because they miss heart attacks most of the time because they think, first thing they think females don't suffer heart attack.
Yes, I'm afraid I did come into this thinking that.
To some extent it is right because estrogen protects them. But it doesn't gives them 100% immunity against heart attack. So that they should know. The women, they present commonly, the symptoms will be shortness of breath. They also complain of palpitation on exertion. And sometimes weird pain, back pain, lower back pain. All these symptoms are a little bit different from what men normally suffer. Multiple studies have shown once the women attain menopause, the risk of heart attack or risk of heart disease is similar to men of similar age group.
Okay.
Because estrogen protects them till menopause, not 100%, again. So to some extent, but post-menopause, they carry the risk what the men of similar group has.
Are there any sort of particular circumstances when a heart attack might happen?
The studies have shown most of the time heart attack happens early morning. Why is that? Because there is sympathetic overactivity, especially in dreams and all when they're about to wake up. There is hyperactivity. That is the time blood pressure shoots up. So they suffer heart attack. The other scenes where they suffer heart attack is sudden shock, kind of, any sort of shock, whether it is physical shock or a mental shock, any news. What happens is any sort of anxiety, and that will cause a rise in your blood pressure, increase in the heart rate, your heart start beating faster. All this in the background, if there is a blockage in the heart vessel, the blockage ruptures, and that leads to clot formation, and that transforms into heart attack.
should we be more careful about how we give the elderly bad news?
It depends on the personality. Some people are quite, sensitive. Psychologically, they cannot withstand even a small events. Not everyone suffers heart attack with the bad news. Only few, and that too people who have already blockages in their heart.
What I'd like to do now is bust a few myths with you. That's sort of true or false. I work out daily, so that means my heart is healthy.
And that's a myth. Yes, working out is important. It's a part which is required to maintain your heart health, but it doesn't give 100% immunity against the heart problem.
I only ever use olive oil in my cooking or as dressing on salads, so I don't need to worry about a heart attack.
No, that's also a myth, because you should know no oil is 100% safe. Yeah, we categorize oil into two categories, saturated and polyunsaturated fatty acid. So saturated fats, by definition, you should know, they solidify at room temperature. For example, clarified butter, palm oil, coconut oil.
All bad.
They solidify at room temperature. They are rich in saturated fats, which gets deposited in the arteries in the heart. So they come with the higher risk of blockages and heart attack. Polyunsaturated fatty acids, where olive oil is one of them. There's sunflower oil, canola oil, mustard oil, groundnut oil. All these oil, we call it as heart healthy oil. That doesn't mean you can consume them in high quantity. Heart healthy in the sense they have polyunsaturated fatty acid, which improves overall heart health. So they have to be consumed in a limited quantity. Even when I talk about these oils, we should know how the American guidelines recommend is either you can consume oil, you can change every month. For example, this month you'll take you'll depend on olive oil. Next month you can go for sunflower. Third month you can go for mustard, or you can mix all of them and then use. This will give benefit of all different oil together. That will benefit your heart.
I thought that if you used olive oil, it was actually good for your heart. I thought it sort of balanced out maybe some of the bad fats that you were consuming.
They contain polyunsaturated fatty acids, which helps in heart. But again, olive oil cannot be consumed in high quantity because the bad effect, it leads to high bad cholesterol and blockages in the heart. Some amount of cholesterol is required for brain function, for body function. So that's where we say have oil in a limited quantity, just enough to maintain your health, to give taste to your food, but not in high quantity.
How about I am young, so I'm protected. I don't need to worry about having a heart attack.
No, that's a myth. Nowadays, even as early as like 20s, we see heart attacks. That's surprising, painful, but this is the fact.
I had an ECG done. It came out well, so I'm going to be fine for another year or so.
This is again a myth. Normal ECG, it just says like you have not suffered a heart attack at present. What will happen in the future cannot be detected because the blockages in the heart cannot be detected by a simple normal ECG. So we run battery of investigation like stress test and other tests, CT, angiogram if required. They will help us to identify whether you have blockages or not.
I've realized that I need to ask you what an ECG is.
ECG is electrical activity of the heart, which is reflected on a paper. So that helps us to understand.
It's the ziggy-zaggy
exactly.
thing. Okay.
That is
I've watched Grey's Anatomy. I know. I've seen what that looks like.
So it represents the electrical activity of the heart, and indirectly it says if it is normal, we consider that his or her heart is functioning normal. If it is abnormal, that is something has gone wrong in the heart.
So another true or false, I'm thin, so I won't have a heart attack.
That's a myth. A lot of guys come and say like, I'm thin. Why did I suffer this? Then I have to explain them. They run genetic, history. They will have a strong family history. And they are smokers, heavy smokers, or they'll be having diabetes, which is not controlled, or their cholesterol, though they are very thin. See, again, the next question, what they ask me is, I am thin. Why my cholesterol is high? I don't even eat, red meat. I'm pure like vegan. So why did I have this cholesterol? This was supposed to be for non-vegetarians. So I'm pure veg, vegan, and I'm very thin. So it's a myth. You should know cholesterol in the blood. When we talk about bad cholesterol, 70 to 80% of this bad cholesterol is produced in our liver. And this is determined by your genes. Only 20 to 30% will come from the diet. So don't think, okay, if I don't eat non-veg, if I don't eat fat, I should not suffer.
Okay, I'm going to admit something now. I went and had a health check recently, and it turns out that while my blood pressure is good and fine, I do actually have quite high cholesterol. And I have never felt more cross.
See?
Because I'm slim, I
I know,
exercise, I'm really careful
this is
about what I
exactly I'm
eat.
saying.
I don't let myself eat sugar, for goodness sake.
No. Did anyone in your family have high cholesterol?
My
or
mother.
See?
She's alive still, which is good.
But it's determined by genetics, right?
Yeah.
That's what I was telling you. Like, I believe even your diet is very good. Despite of that, your cholesterol is high. That means 70% to 80%, the liver, what is producing is genetically determined.
Okay, without turning this into too much of a private doctor's appointment, what can I do about it?
The best way is you can have plenty of fruits and vegetables that protects your heart. Saturated fats to be avoided. Most of the time when we go out, we don't know if it is saturated. So avoid junk foods, preferably homemade foods. We know what oil we are using, how much oil we are putting. So we are very safe. Chicken or red meat, you can have it, but preferably if you can grill them and eat them, that is good. Despite of all this, still if your blood cholesterol is very high, indeed, you have to go for pills, which will take care of them.
Okay, so say I have made a decision today that I'm going to spend the next month or the next 2-3 months trying to make my heart healthier. How quickly will I start to see my heart get healthier?
Depends on the kind of risk factors any individual has. For example, a person who's smoking, who's diabetic, who has hypertension, family history. Consider this we consider as a high risk. The bigger the risk, if he modifies his lifestyle, the bigger is the benefit. When it comes to smokers, if you stop smoking, the benefit is instantaneous. The same day the benefit starts. I'm not saying it's very easy because overcoming this crave to smoke, anxiety what they run, and dry cough what they have. All this is a bit difficult. I'm not denying that there are other ways you can overcome that. There are solutions. So it's not something which is very difficult to treat, and all these symptoms persist maximum for 1 or 2 weeks. And one can take help of nicotine gums or patch, which will help them to reduce craving, and finally they can get rid of gum or patch as well. The benefit what they get in the first 24 hours, if you see where the carbon monoxide level in the blood reduces, that'll make them think better. They can start concentrating in their work in a much better way. Sleeping improves. Subsequently, in the next couple of weeks, what they start noticing is the breathlessness what they had, it improves. Cough reduces. Phlegm production comes down. Oral immunity increases. Their efficiency improves. So long term, more than 2 months, more than 3 months, what you can see is it comes with a bigger benefit of reducing the risk of heart attack, risk of stroke. And studies have shown if somebody quits smoking today, after 1 year, the risk of heart attack and stroke reduces by 50%. Imagine 50%.
I mean, that's extraordinary.
And 10 to 15 years, if he stops, his risk is similar to any non-smoker.
How about vaping?
No. E-cigarettes, vaping, all these are equally bad. So
they're just as bad.
They're just as everything has proven beyond doubt. All of them carries the risk of heart attack, stroke, and death.
Okay, so how can you bring your blood pressure down?
What is important is first thing, identify whether the person has high blood pressure or not, and then try to control it, because high blood pressure comes with the risk, or long-term high blood pressure, uncontrolled if they go, it comes with the risk of heart attack, risk of stroke, which can lead to death as well. So how do we control it? The best way, if the blood pressure is borderline high. So what the guideline target is 130/80 and less. This is what we recommend if that is a normal blood pressure. And we become more aggressive if it goes more than 140 systolic and more than 90 diastolic. We become a little more aggressive. So if the person has a borderline high blood pressure, we advise them to modify lifestyle. What sort of lifestyle helps in reducing blood pressure? Adequate sleep, less of salt in the diet, good exercise. So exercise in the sense aerobic exercise, not the anaerobic one like cardio exercise. Either the brisk walk or running, jogging, swimming, sports, any of this will help in reducing blood pressure. Then plenty of fruits and vegetables, that is also known to reduce blood pressure. Part of that, if the blood pressure is very high, obviously we have to start medications which will take care of blood pressure.
How much salt should we be consuming?
Normally, on an average, it's been seen 5 grams of salt is what most of us consume every day. And if there is a risk of hypertension, if your blood pressure is going high, we say half of that, like approximately 2.5 to 3 grams is what you have to consume.
Okay, we're turning over a new leaf. We're going to stop smoking. We're going to start exercising regularly. We're going to go to bed on time. What difference will we see in our health in 30 days?
First thing what you start noticing is the next day you feel fresh, you feel more energetic, your work efficiency improves, your concentration in the work improves, the physical appearance will improve because you're working out every day, you're having adequate sleep. Even you will start losing weight, which is beneficial for your health. All this with time will be more visible. And it has been seen the heart health improves. The risk of heart attack, risk of diabetes, risk of stroke, everything reduces when you do them regularly. Obviously, you're reducing every possible risk which will affect your heart.
Can you reverse damage to your heart then by living a healthier life?
Once anyone suffers a heart attack, it is a death of the heart muscle, and these are irreparable. That is where we say, rather than waiting to suffer a heart attack, if we realize it much before and modify our lifestyle, if we can prevent it, that's the best thing. But when somebody suffers a heart attack, can it be reversed? No. The damaged heart, what our aim will be to prevent one more episode, recurrence of episode, because a person who suffered a heart attack will be considered to be a high-risk candidate. He might run the risk of recurrence of heart attack. So that's where we try to be more aggressive in terms of lifestyle modification, diet, exercise, as well as medication. It's not something which they cannot lead a normal life. Most of my patients have some sort of damaged heart, but they lead a perfect normal life.
How about if you do manage to catch people before they have a heart attack?
One thing all the audience should know is these blockages, they don't start at 40 or 50. They start right at the age of 10 or 12. They form small plaques, we call. And then those plaques, depending on the risk factors, if they have high cholesterol, the building up of plaques, that means the narrowing of the artery will be fast. However, if everything is fine, it goes very slow.
So this is something we should consider as parents even?
Absolutely. So the lifestyle should begin right when they are small kids. So it's better as a parent, we should try to develop healthy lifestyle in kids, encourage them for exercise, less screen time. All of us are suffering with this. We have to limit the screen time for them, encourage them to get involved in sports. Diet is something which all of us are suffering as a parent. So we have to push them to have plenty of fruits and vegetable, healthy home cooked food rather than eating from outside. So if they continue this, that will protect them against future events.
When there is a heart crisis, when there is a catastrophic moment, there are literally minutes to spare to save somebody's life. First of all, I want to ask you, if you see someone having a heart attack on the street next to you, what should you do?
The best way is ask him to relax, do not move, because any amount of exertion will trouble him more. Help him get either the wheelchair, call the ambulance, help them to be shifted to nearest hospital, because what helps us is, first thing, he has to be seen by any doctor. An ECG has to be done, which will help us to understand whether that is heart related. And then even if it is normal, we know we have to run some battery of investigation to make sure it is not a minor heart attack as well. However, it shows any major changes, that helps. If you have aspirin, that helps, to some extent, because heart attack comes with the clot formation. Aspirin is known to, prevent further complication of heart attack. You can give them.
How do you act in those moments as a doctor? Because every second counts, I imagine.
Absolutely. There's a difference between a major heart attack and a minor heart attack. So major heart attack comes with the risk of ongoing damage to the heart, as well as risk of loss of life. Sudden death is known. So we deal major heart attack in a complete different way. So a major heart attack coming to our hospital, immediately our aim is to crack open the blocked artery and establish the blood flow. So wherein a heart attack coming to our hospital, immediately we'll do an EKG, confirm first the heart attack. And once we confirm the major heart attack, we take them to the cath lab. Cath lab is an operating area for us, wherein we do an emergency angiogram. Our aim is immediately open the blocked artery.
So
to stop the process of heart attack.
Them up.
We do it regularly. So what we do in that, we insert a tube from the wrist artery that goes all the way to the heart. And then we take the pictures of the heart. And this helps us in understanding which of the artery has troubled him at that point of time. Once we identify, then we crack it open with a balloon. Then we insert a stent. Stent is a metallic scaffold. So balloon opens up the artery, and to keep the artery open, we have to insert a stent, and that is a metallic mesh. So that'll stretch the artery, keep the artery open. By doing this, the heart attack stops instantaneously.
I was imagining you with a scalpel and, digging in and like, I've clearly
That's
seen
open
too
heart
many.
surgery.
That's
So
open heart
that's
surgery.
open heart surgery.
So when do you need open heart surgery?
Any individual having multiple blockage, a person coming with angina, a diabetic patient, when he walks, he's complaining of discomfort in the chest. Stress test was positive. We do an angiogram. We find blockages at multiple levels because we can insert stent, but studies have shown when the person has multiple blockage and when we insert stent compared to bypass scores much better. The results are better with bypass compared to stents.
What do you do in the bypass? I mean, I can kind of guess it bypasses
Exactly. As the name suggests, it bypasses the blockage. But it's an open heart where the surgeons cut open the chest. They either take the artery inside the chest or they might take the veins from the leg. So what they do is they bypass the whole blocked segment to the normal segment. Things have evolved over a period of years. Earlier, I would say 20, 30 years back, the surgeon had to cut open the entire chest and here patient heart, they had to stop heart. They used to put the patient on bypass, they used to operate. But now things have evolved. So minimal invasive surgery where they hardly few inch incision in the chest, or now robotic surgeries have come up where very small incision and patient is good to go home in 4-5 days.
Someone's just had a heart attack and you saved their life and you could have met them beforehand. What would be the one thing you would have said to them before they had that heart attack to stop them going through that awful crisis?
Whenever I see a person presenting with a heart attack, I always feel like, wish I had seen him earlier. I would have guided him in a different way. I could have prevented this event.
How does it feel when you lose a patient?
The moment I see any heart attack patient who comes to hospital, when a major heart attack comes with the risk of loss of life, all of us know that. So our aim is to protect, to save life. So it's not like 100% of the time we save lives. Even we see deaths. So when I lose them, I feel like terrible. I wish I had seen him a bit earlier, maybe a week earlier. If I had seen him, I would have done something which would have probably helped him to save his life. So when I see family crying, even I become emotional. It feels like, even I lost someone, my own. So that is the kind of thing what I feel. Even at home, even my family, my wife keeps saying, why are you so emotional? But this is the way I am. I think being emotional is not something bad. I feel getting connected to my patient will make me more efficient to put my 100% efforts. What best I can do, I will be able to do if I'm connected to the patient.
It's probably not on me to thank you, but thank you for your hard work. It's extraordinary. Thank you for saving all those lives. If I've learned anything from this conversation, it is that just one simple change to your lifestyle can really make a difference to your heart health. So please, this World Heart Day, do go ahead and make that change. Dr. Naveed, thank you so much for your time.
Thank you.